Hey everybody, how's everything been going? Hope you had a good holiday. Let's go ahead and start off with questions.
And if there's a private question you don't want to share with other people, you can type it in over to Apothecary Geek and I can read that over to Greg.
Greg?
Yeah,
Hey.
It's Robin. Hi.
Hey, Robin. Hey.
You must get tired of getting the same questions.
No.
So I'm having a front tooth root soreness that's kind of freaking me out a little bit.
It's on the upper part?
Yeah, the upper part towards the center midline. It's
Okay.
sore. Yeah, it's sore to the touch. It's not hurting, but definitely something is going on.
Do you have any sinus issues going on right now?
I don't have sinus issues right now, although Yara was pointing out, I am snoring. If that is a sinus issue, I don't know.
No mucus or anything? You're not smelling any weird smells? No pain in the face?
No, I
Okay.
mean, my eyes, I'm on the computer too much. So I'm having tension around my eye sockets, but,
Okay.
and I have a history of hay fever and all that stuff that you're talking about. I do definitely have a history of that. And I'm capable of getting up in the morning and, you know, sneezing and having mucus, but I haven't been having that so much last couple of days anyway. Or
Yeah, the reason I ask is that sometimes sinus issues will manifest. There'll be like a radiating pain that goes down into the teeth. And so, you know, different segments will radiate down to different areas in your mouth. And
you know,
so,
Greg, I have noticed that because I have been continue to be under a lot of pressure. I have noticed
Sure.
that my tongue is tense and my mouth and jaw are tense. So I do know that.
let's do a little bit of a shotgun approach. So one of the things that you can use ideally for tooth pain and even a little bit of infection is clove. But if you don't have clove, tea tree would work.
I do have
tree-
cloves. I do have cloves.
right. Take like, you can put it on your finger, but it might make it burn a little bit. The easy way is to put a whole bunch on a Q-tip and then poke it around that area. I put it on my finger and then rub it all over the area. So the thing is the clove will reduce the pain and it is really good for fighting infection. Really super good for fighting infection. The other thing that I would do is I'd probably rotate with the clove, you know, not at the same time, you know, like some hours apart. Gargling and kind of mouth swooshing with a couple of drops of bay laurel and some water.
Got that.
Really cover that area. Again, bay laurel is one of the best things for cleaning up the lymph nodes of the neck and one of the best things for multiple types of bacterial infections.
All right.
Then I would probably inhale like sinus support or like rosemary, you know, something basil, petitgrain, you know, something that will help loosen up the sinuses and reduce some of the tension in the sinus mucous membranes. And so, you know, if you're under a lot of stress and tension and you're feeling tension in your jaws, marjoram can be very good, you know, inhaling. You could actually even take a few drops and kind of rub it on the jaws on the side. That can be good. And sometimes I like to even augment that with 400 or 500 milligrams of magnesium, you know. The magnesium doesn't fix it, but it you know, sometimes what starts to happen when we're under stress is we deplete the serum levels of magnesium in your body and your body starts like tensing and clamping down.
Yeah.
And the other thing is be sure you're drinking enough water. You know? Yeah, like the other thing is we get under stress and sometimes we can reduce our fluid intake, and then
Yeah.
that could cause tension and cramping.
Okay. Okay.
Yeah.
Great. Okay. Thank you
Yeah.
so much.
You're so welcome. Yeah. Hope you feel better. If you don't feel better in a couple of days, let us know. But that
Okay.
should start knocking that out.
Yeah. Yeah. Okay. Great. Thank you.
You're so welcome.
Go ahead, Christy.
Hey, Christy.
Hi, everyone. I'm
Mhm.
asking a question on behalf of a student who's overseas and can't do these live.
Okay.
So her question is, what would you say the difference is between the Aura Cleanse blend and the Masters blend?
Just two different ways to the top of the mountain. They both clean the aura.
Okay, perfect. Is there one
Yeah.
you would recommend in certain situations? versus another?
For me, I just grab one or the other.
Okay,
Yeah,
wonderful.
they're both pretty good for, they're just slightly different oils, and more than slightly, they're different oils. And so, there's a lot of different oils that clean up the energy body. And so both of those kind of do the same thing.
Okay, wonderful. Thank you.
You're so welcome. How
And
have you been
yes,
doing?
Oh, absolutely fantastic. I was saying, yes, your clothing gets fancier and fancier.
Yeah.
Looking good.
Yeah, thank you.
Is bay laurel mostly for gargling, or can it be taken internally in water?
Oh, no, great question. Bay laurel can be taken internally. Bay laurel is really good for opening up and helping to clear lymph nodes. And it's good for fighting infection. It's also good for the respiratory tract. And so you can take a few drops internally. You can take a salt bath in it. I just took a salt bath in it about a week ago. And yeah, it opens up the lymph nodes. And so you can use it as a gargle. Yeah, you can use it as a compress on the joints, the affected joints. You can add it to massage oils, or you can add it to some sort of respiratory, protocol. And so good for the lungs, and I mean, really super good for infection and moving lymph. So really super good.
And you guys can unmute at any time.
Yeah, unmute or type in.
Someone asked, I have a question having to do with liver function. I have been working with a lady that son was in the hospital for over 2 weeks without being able to urinate. He is about 13 years old and came back with a diagnosis of diabetes 1.5.
Okay, and so your question, you're trying to address the urination issue, or you're trying to deal with, like, what are you trying to deal with?
How to address the urination and improve function of the liver.
Okay. Kidneys, I mean, if he's not urinating, I'd address the kidneys just right off the bat. Something like that where there's not a lot of urination happening. My go-to oil is actually sandalwood. Sandalwood helps to break up blockages in the pelvis, in the urinary tract. It's a very good diuretic.
They meant kidneys, not liver.
Yeah,
by the way.
okay. Yeah, I was wondering, but yeah. So I usually do the sandalwood, like 2 or 3 drops in water, and then have them basically, you're starting to take a diuretic, and at some point, as they start to urinate, I would actually start to have them, drink more water. But I'd probably wait until they start urinating. After probably a week or 2 of that, The next thing I would have them do would be parsley. Like I'd switch from sandalwood over to parsley and have them do that for a while, like another 2 weeks or so. And then I actually have a little protocol for this. Let me look this up. Yeah, I'd have them do. After parsley, I'd have them do lovage. So I do sandalwood for a while, then I'd have them do parsley for a while, then I'd have them do lovage for a while. All of this would be internal. And as they start to urinate, you have them increase the fluid volume that they're taking in. And, you know, with the use of the diuretics, you kind of are flushing out the kidneys. And so if they're anxious, if there is high levels of fight flight, you can have them inhale like something like marjoram, and then or support something that's going to help reduce the anxiety. Is there anxiety, by the way? Or like high levels of stress, or they had a stressful event? Yeah, let's have you also maybe inhale marjoram for 15-20 inhalations, even a couple of times a day. It will help pull them out of fight flight, and sometimes it can be they're holding back in urination, or they're starting to urinate too much because of excessive amounts of adrenaline, and so that should help start to calm things down. Let's start with that and then have you report back and see how that's going, and we can augment that based on how the person responds. Sometimes if they don't respond well, that still tells us something.
So the sandalwood, the parsley, the lovage, all 2 to 3 drops, even though they're 13 years old.
Yeah, like two drops, that's still a casual dosage. If they were older, I would actually have them do more. But given that their age, 2 drops is probably pretty good. And they're not taking them all at once. You're doing sandalwood for a few weeks, then you're doing the parsley for a few weeks, and then the lovage for a few weeks. Is there trauma? I'm just curious. Like recent traumas?
I believe so.
Let's have you do tarragon before the marjoram. I mean, the marjoram wouldn't hurt, but the tarragon will calm down some of their body systems. I think that's needed, actually. Yeah, keep us posted on that.
I have a friend who has rheumatoid arthritis,
Mhm.
and the cortisone shots are not as effective.
Yeah.
Lately, she has been experiencing flare-ups. We talked about doing protocols with essential oils. I looked at the pain workbook, which would be a good protocol to start.
Yeah, so the pain workbook, I just happen to have that up in handy, or I did. The degenerative pain. And so the big key one there is the first step is really treating the I assume it's the hands and the feet, or is it hitting the spine? Where is it hitting?
Hands and feet.
Yeah, so there's that blend joint relief. I would take that, and in a 4-ounce bottle, I put about 90 to 100 drops of the oil in the 4 ounces of alcohol. I usually use vodka, but if you want to use rubbing alcohol, that's fine. It's just vodka is not as irritating to the skin. And if they don't want to do the alcohol, or if that's not accessible, you could do it with massage oil or lotion, but it still has to be a pretty big dosage. And then have them rub that on their hands and feet daily, and they'll notice an improvement within a few minutes. I mean, it's really quite quick. And so, like, really stiff hands, like where they can only go like this, they'll start going like this, and their pain will go down quite substantially. So that is usually the very first thing that I do with rheumatoid arthritis. As time goes by, we start adding the lymphatic blend or chocolate root cleanser, just to help move the lymph in the area. But right off the bat, it's going to be all about the joint relief. There's four segments from the degenerative pain segment in the book. So there's those two. There's also arthrocare. The arthrocare is especially good for when there's like pain in the thumb joint, like back at the almost to the wrist. There can be some spurring in there. That can be very, very helpful. And then the last one is to use like trigger point blend or fascial release. That's down the line. The very first thing is the joint relief. I mean, you could use that for just a month or two, and that should bring them quite a bit of relief.
If I don't have joint relief at this moment, is there any substitutes?
You'll have to blend something yourself. You'll have to blend rosemary, cedar, and either juniper or pine. I mean, that's a very, very simplified version of it, but there's really not a substitute for that one. But you can blend those, just for now, just blend them equal amounts.
Go ahead, Balaji.
Hey, Balaji.
Good evening, Greg. Again, another nice dress. You look like a Maharaja, right? Yeah. Okay, so quick question. So my first spiritual teacher, because he lives in New York and had upstate New York, and had gone to visit him on Sunday. So again, he's like an ocean of knowledge, like you. He's like tons and tons of knowledge. So he was recently diagnosed with the Parkinson's disease.
Oh, yeah.
So again, he's mentally alert for sure. Again, he's really alert, but he has a lot of like a shaking and balance issues right now. So I was wondering if there's anything I can sort of like do to help him out.
Do we know, did he ever have a head trauma?
No, because I've been knowing him for a long time. Like, yeah, he's been, again, I don't know, but I don't think so. But I'll ask, but yeah.
Okay, give me a sec here.
Sure.
Give me just a second.
Sure, sure.
There's no one like straight way to kind of address this or deal with this. Um, okay, one more second. Um, for him, I would probably try myrrh
Okay.
and bergamot.
Okay.
Yeah, the myrrh I would probably have him take internally,
Okay.
and the bergamot just inhale. No pattern, just inhale.
Okay.
Yeah.
And so he can do this with the other medication he's taking.
Yeah,
He should
yeah,
be okay, right?
won't, yeah, won't interfere.
Okay.
Yeah.
Okay. So start with this and then myrrh, like
I
how many
would
drops?
start with this, but I mean, it's not going to be an immediate result. Like, you know
Right.
what I mean? It's going to be treating for a while.
Okay. Okay.
Yeah.
And then internally, couple of drops.
Couple drops of just the myrrh,
Right. Right. Yeah.
just the myrrh. Yeah.
Okay.
If he does want to take it internally, like several drops on his wrists and then have him rub his wrists together.
Okay. Okay. Um. All right. Okay. So is there anything else, like Greg, I can like I don't know do in addition to like these or this step, as you said, like first step, but anything?
Yeah. It's a tough one.
Okay.
It's a real tough one. You know, it's different from because it can be different causes. And so I'd be really curious to see if he's had a head trauma. You know, that gives you a little bit more of a clear path.
Okay.
But you know, you can always have him inhale like something like rosemary just to increase circulation to the brain.
Okay.
But you're just really treating circulation. That's not really addressing the condition itself.
Okay.
Yeah.
Okay. Great. Okay.
Yeah. Let's start with that.
Sure. Sure. Okay. Great. Thank you very much, Greg.
Yeah. How old is he, by the way?
It's like around like 78 or 79 right now. Yeah.
Yeah. Yeah. Yeah. At that age, rosemary could be helpful.
Okay. Okay.
Yeah.
Okay. Great. Okay. I'll definitely.
Yeah.
So just these, and then I'll keep you posted. So
Okay, thank you.
thank you, Greg. Thank you very much.
You're so welcome.
Hey,
Okay,
Greg,
fine.
this is, oh,
Yeah, no, go ahead, Cassandra. We'll get these later.
I'm listening to the last three questions, and the common theme potentially, the common theme with those and some other things I've been researching comes back to detoxing and how to do it safely. And this, like with the metals, the aluminum, cadmium, all those things. And I'm
Mhm.
curious because I'm learning more about chlorella and spirulina and the algae and all of that. But the bay laurel hits the parasites, right? Or which one hits the parasites?
No, if you're trying to clear out parasites, I would use probably more clove oil.
The clove. Okay.
Yeah.
What?
Couple drops in water internally. And then I'd go to not using wormwood essential oil because it's too potent to take it internally. You would go to wormwood herb, capsules, and
Herb
take some of that.
capsules.
Yeah, but clove oil is really good for parasites.
And it's really interesting. I mean, the common theme, it seems to be so many of our ailments come from outside of trauma, outside of accidents and things like that, come from this stuff that builds up in our brain and our body. And I just wonder how much we're really, as a society, paying attention to that, because the foods we eat and just what we get, because I walk barefooted all the time.
Yeah, I mean, it could be foods, it could be physical traumas, it could be things like where you slipped and fell, or you bumped yourself, or somebody bumped into you and causes a series of spasms, and then the body goes into spasm and holds the joints in that particular area kind of tightly, and fluid doesn't move as easy. There's all
Mhm.
kinds of variations that can happen.
That makes okay. Just
Yeah,
interesting to kind of pull all this together. So I'm trying to keep
yeah.
in mind as I'm researching one thing, how to keep the oils kind of in there, how to
Mhm.
combine the different techniques. And of course, I'm not saying I'm doing everything. I'm just learning, because I certainly
Sure.
want to be careful. But just listening to this, I keep thinking there's all these common themes. So thank you for sharing
Yeah,
all of
yeah,
this.
my pleasure, my pleasure.
And Robin, you had a question?
Hang on, I'm finding it. Okay, yeah. So a couple of the things people have said triggered my memory here. One of my closest friends, 45-year-old son who's got 4 kids, is under surgery right now for a spinal cord injury from surfing yesterday. So he's in the middle of a 6-hour surgery right now.
Mhm.
And if he didn't have the surgery, he would be quadriplegic. And
Oh.
I know they're hoping he'll be fine. I'm just wondering if there's any support that you could think of in a situation like
Yeah,
that.
something like that, they're trying to correct a structural problem, and then they're probably going to pump him full of steroids to reduce inflammation on those areas. And so, you kind of don't want to do anything that interferes, but still be supportive. And so a really good general thing is black cumin internally. Super anti-inflammatory, helps stimulate the body's healing processes. And then the galbanum. The galbanum really helps to take the edge off the pain and take some of the tension out of the body from the pain. And with everything that is going on, I'd have him be inhaling tarragon just big time.
Okay.
It will calm down his emotions. It will help him kind of address with the changes that's happened to his body with the accident. And it is also super antispasmodic. And so it will take some of the tension down. So when you're dealing with a traumatic injury like that, you have the damage to the structure, being the spinal cord. Then you have the damage to the spine, the bones that would protect the spinal cord. So those are two key things, but you also have the muscle and the fascia around the area are going to try to tighten up to protect the injured area. They're doing surgeries and they're cutting it open. So
Right.
who knows to what degree that's happening, but even post surgery, the tendency is for that to tense up. And that's where a lot of the pain comes from, is the soft tissue. Bones can be compressing the nerves, but the soft tissue itself is usually the source of the pain. And so the Tarragon can be very helpful. Like after a period of time, I would probably switch him over to Hyssop decumbens. And Hyssop decumbens will relax his diaphragm and relax the muscles along the spine. But I would say that's a week or two out.
Okay, so let me just get this. He's going to breathe the tarragon, and then
Yeah.
after a week or two, he'll breathe the Hyssop decumbens, and
Yeah.
internally he'll take that magic galbanum and
Yeah.
the black cumin.
Yeah, right. And just, a couple drops at a time, the body becomes way more sensitive when it's been traumatized like that. And
Right.
so like you almost have to kind of spoon feed them for a little bit before they can take more. And
Okay.
so even if he can't get anything down or he doesn't want to do it, even inhaling the galbanum will be helpful. The black cumin's got to be taken internal. There's kind of no way around that one. But if he doesn't want to do it, just have him inhale the galbanum and the tarragon for a while. And as he gets a little bit better, then shift him over. He can stay on the galbanum, but then the hyssop, especially decumbens, but any hyssop will work, but the decumbens would be much better.
Okay.
Yeah.
Okay. Thank you.
Yeah, so sorry. Do we know what part of the spine got injured?
Yeah, it was like the 1 and 2 were going to be fused, and let's see, I've got the text right here. There's a couple of them that they are going to be fusing, I think. Let's see. Yar, do you have it? I'm getting the wrong email. Just one second. We've got it. Oh, here it is. Okay.
Okay, fused, C1 is fused to C2.
C1 is fused to C, and C5 and C6 and T1.
So it's all up real high.
Yeah. That's why they said he could be quadriplegic if they can't
Yeah.
fix it.
That's a pretty serious injury.
Yeah, it's serious. He hit his head on his board. Oh, the sand? Either the sand or this board. He got trashed in a way. In California, he's in California.
Yeah,
Yeah.
all those same things, but I mean, if he's not into doing that, because I mean, that's, yeah.
He's a really tough guy. He doesn't want to take the meds. He's like a macho man.
Right,
kind of
right. Yeah,
CEO kind of guy,
yeah. Yeah, see if he'll try those things. And,
Okay.
and we'll go from there.
Okay. Thank you so much, Greg.
Yeah. Boy, yeah. Sorry to hear
I
that.
know it's one of those shocking
Yeah,
things.
yeah.
Yeah. Thank you.
Keep us posted.
Okay.
And go ahead, Balaji.
Apology.
Sorry, Greg. Just a follow-up question on the myrrh and bergamot. So, what should I tell him? Like, how will it help? So, in just case they ask me, so that I can answer
Yeah, you're just trying to stimulate some dopamine production
Okay.
and help some of the nerve receptors in the brain and the body.
Okay. Great. Okay.
Yeah.
Thank you again, Greg.
Yeah, yeah.
Yes, I know I spelled that wrong. I just don't want to miss any. I'm going to go back to the start. You guys can unmute at any time. Otherwise, I'm going to try to go through these here. Do you have suggestions for an older woman who has hit her head against the wall, swimming laps a bunch of times? She's concerned about possible impact, no pun intended, on her brain. Didn't mention specific symptoms.
With something like that, I would usually start with like chamomiles or helichrysum, inhaling, and even if she could work it into putting a few drops in her hand and rub it in her scalp or upon impact site. The issue being that when you hit your head like that, you have the outer bruise, but sometimes there's a lesion that's on the other side of the skull. The chamomiles and the helichrysum do help that. Lots of inhalations. Yeah, you could actually even do some rosemary. I would actually do petitgrain, but I'd like to see the chamomiles go first. Roman chamomile, German chamomile, Cape chamomile. Anything of that nature. Helichrysum.
They sent her some helichrysum.
Perfect.
If they were older, how many, did I already ask this? If they were older, how many drops would you recommend of sandalwood and parsley and lovage?
If they were a full-grown adult, I'd probably start off with 3 or 4 and then work up to 5 or 6. Yeah.
And for, yeah, I haven't quite gotten, but I'll get to it right now. With the joint relief, did you say 100 drops for 4 ounce?
4 ounce, yeah.
I have a dear friend. She is 61 now. Deep sexual trauma since childhood, followed by many intense life experiences. Her adrenals are not working or overworking. She suffers from chronic fatigue despite being very active. She also suffers from depression. She has been on the spiritual path for years now and working very hard. She has tried many things and is still experiencing all the symptoms. Even though she has been very active lifestyle, her knees and joints are not well. She gets cortisone shots in her knees. She is desperate and doesn't even know what to try anymore. There has not been much improvement. Anything you can recommend, any oils, any protocols? And then there was also, she is very strong mentally and hard to let go of things. She's holding to a lot of frustration and anger and currently having her inhale Lang Lang.
Frustration and anger is about things current or things from the past?
life. So I'm guessing
Just
both.
not just difficulty in life. Yeah. Let me think about it for a second. I'm gonna break for just a restroom break real quick. Let me go to the bathroom real quick. I mean, there's definitely different levels that you could treat here. You know, if you look at it, you can start treating it in pieces. And when you start to have like so many different symptoms and different angles that are happening, probably one of the best things that she could do is do the vital centers. She doesn't need to do like the whole class, but just inhaling the vital centers in that order that they're presented in the class. She doesn't have to even follow the patterns. You know, that will shift her emotional body, and that will shift the physical body. We'll have a reduction in symptoms and pain levels. It doesn't mean that that's the only thing that you would do, but it would make the other things more easily treated. You know, when it comes to the sexual abuse or, you know, the sexual traumas, I usually give them Vitex, and I have them inhale helichrysum, you know, simultaneously. Like, you know, you put the Vitex on in the morning, and then at some point during the day, have them go through and inhale the helichrysum at least once, if not twice a day, 15 to 25, preferably more like 25 deep inhalations. Usually with something like that, you're also going to need to release the diaphragm, which would be, again, deep inhalations with hyssop. The joint issue can be achy joints. That would be lymphatic work. And, you know, the lymphatic work could take on a lot of levels. You could just go through and treat the lymphatic system. You could start her with just like maybe a couple drops of lemongrass, but it might be that you need to do a really deep lymphatic session, or, you know, work with the person. And That usually involves the use of diuretics, increasing water flow, water intake, um, the use of absinthium applied to the gut for, probably every day for 2 weeks straight. And then going a little bit deeper into the lymphatic mechanics, working on the joints themselves to open up the lymph nodes. The issue that strikes me is like if the body is having joint pain all over and there's inflammation, there's probably even some foot pain, there's probably a lot of fascial inflammation, which means that it's not going to respond to normal anti-inflammatory type approaches. The best thing that you can do for inflammation in the fascia is actually a liniment that's sprayed on the body with just lemongrass. Very, very helpful. It's very, very soothing. It calms the body. It helps to regulate the autonomic nervous system. And then you can augment that with the use of bay laurel to help, clear out the lymph nodes. It depends on how much the person's wanting to do treatment and, how much time, because somebody's going to have to guide her through it. So how much time that you're able to put into it. And, there's a lot of factors in here. It's not just going to be a single oil or two. It's going to be several cycles of different things. And I think, it's very possible to help the person, but, there's also other factors. And so, if you're just trying to get some joint relief, that blend joint relief would actually be helpful. So you could take salt baths and just rub it on in a lotion, and that would be the beginning of it. But there's several things there to address, and so it just depends on how much effort both you and the person want to put in. I'm more than happy to help start the process and program and continue it as time goes by, but kind of give us an idea. You can do it through email. You don't have to do it right here. Give us an idea of what the person's willing to do, and how much effort. It helps me to gauge, because you can write out the perfect plan, but if somebody doesn't do it, or it's too much for a person, then it's not the right treatment. We want to meet the person with where they're at, not necessarily what we could do, but just meeting where they're at and helping them get feeling better. The vital centers would be the big thing. Like if I was to say, this would be the big thing, it would be that. Yeah. The vital centers, they help the healing process both physically, psychologically. They help reel your body in. Most times when there's a chronic issue with health, or there's just a bunch of different things going on, almost always the vital centers are super, super agitated. And so the vital centers can agitate the lower emotions, can agitate the body, can make the body not go into rest and repair mode, can throw off your sleep, can throw off how you process information. It physically, psychologically, and esoterically, the vital centers are a big piece of reeling everything in. So, I don't know where you and the person would be with all that, but we can come up with something. But it's just, we want to meet the person where they're at.
She said she wants to feel good and happy. Also, she lost her second husband 5 years ago of cancer, so lots of grieving. She gets overwhelmed very quickly now, almost like the vessel is full.
Yeah, that's vital sometimes. I mean, if you want to start small, have her inhale helichrysum or ginger lily. You know, get her feeling a little bit better, and then maybe you can take a bigger next step. I mean, I said a whole bunch of things, but I really didn't lay a strategy out, because again, it depends on where the person's at. But you know, with a lot of trauma and feeling overwhelmed like that, helichrysum and a ginger lily would be a good starting point. Tarragon would also be something you could throw in the mix right off the bat. Now, Lang was a good call for frustration, but there's so many other things going on that it still would still keep it in play, but it needs to be augmented with other things. Keep us informed with that, and we'll kind of try to tailor something as you help that person.
I've been having tightness in the chest, especially after the COVID shot. The occurrence is farther apart
Yeah.
now, and I'm not experiencing the fatigue that I used to come with it. I started taking helichrysum internally and inhaling Croatian hyssop. Anything else I can do oils wise?
Yeah, it's a common complaint. You know, let's have you take black cumin internally, like 2 or 3 drops, because we have a couple of things here. That was common in some of the post vaccination complaints, and that was in some of the more severe COVID cases. They had a very similar complaint. And so we have a couple of issues here. You know, you have the potential for just some bronchial spasms and spasms in pectoralis major. But the other issue is there could be a little bit of inflammation in the heart. And, you know, it's not seen in all the cases, but it's seen in some. You know, my sister had it really bad after she had COVID about a year ago, and she's still dealing with a little bit of the inflammation in the heart. You know, she won't take into the essential oils or anything, so you know she kind of goes the other direction. But if it's inflammation in the lungs or inflammation in the heart, the black cumin should help reduce that quite substantially, actually. And so I think that would be my play. Is I would have that in play. The other thing that if you happen to have some Ami Visnaga or Anula, Anula. That may be helpful. If you don't have it, I wouldn't say buy it because I'm not sure it will help, but if you had it, I would use it. You know, it would augment anything that you're doing with the hyssop, and you're on the right track with hyssop and the helichrysum. I'd stick with that and augment with black cumin. And if you happen to have Ome Visnaga or
They do.
yeah, inhale that. Keep inhaling the hyssop, but add Ame Visnaga to the repertoire and see if that helps.
I think they might have both.
Yeah, you could rotate them if you have both. Yeah. Ame Visnaga first, I think.
Sorry, I'm just gonna have to go back here, guys. Just going through the questions real quick. Friend had brain surgery, which went fine, then suffered a stroke.
Oh,
What's the best thing I could do from here?
okay, run by me again. You had a stroke, but what was first?
Brain surgery,
Brain surgery.
which went fine.
Okay. But had a stroke during the surgery or after the surgery?
Let's see. After.
Chamomiles would be really super good. And in this particular case, there's an herb called Bacopa, Bacopa. I would put them on relatively big dosages of Bacopa. Like probably 6 capsules a day. So inhaling or internal with the chamomiles and then the Bacopa. Yeah, and keep us posted on that. We might have to adjust what's being done.
My lower back has been having spasms for over a week. I've been using marjoram and cedar to treat, but relief lasts only for a short time. What else would be good? to
Is it
use?
going across or up and down the back? Like does the pain run like side to side, or does it run up and down the spine?
Across?
Okay, that's your abdomen. Like so, take the marjoram and rub it from below your ribs all the way down to like your belt line, you know, in some massage oil. Make it really strong, like put 8-10 drops with a couple pumps of lotion and then rub it all over your abdomen, especially in and around your belly button and up by where the rib, right below the ribs. But if you loosen up the tension in the abdominal muscles, it will take some of the pain out of the back. When you treat it just from the backside, it's like you said, it's real short-lived. It's because the issue is actually radiating pain from the abdomen.
Good afternoon. This is Chris from last week, following up on the groin pain.
Hmm.
Diagnosed now as a strained muscle,
Mhm.
prescribed anti-inflammatory meloxicam, began physical therapy this week. When pain persists, I've been applying peppermint oil, provides relief, which varies depending on the pain level.
Yeah. Okay. Marjoram can help. I mean, the peppermint will definitely reduce the pain. The marjoram will help the sprain or strain in a particular area. Did they say which muscle got strained by chance?
Hi, Greg. This is Chris. No,
Hey,
they
Chris.
didn't. I'm hoping to get a better, more of evaluation at physical therapy when I have my first appointment
Yeah.
on Thursday, and so they can, if it's the psoas or one of the muscles within that area,
Yeah.
then they'll isolate it down and we can attack it that way.
Okay. Yeah, keep trying to put some marjoram on it just to keep it. I mean, the psoas is a little bit harder to treat directly with the oils. You can do it through inhalation, trying to relax them. Hyssop, and then either hanging the leg off the bed a little bit and letting it stretch that way, or to do a little gentle like the cobra pose. But yeah, if it's the adductor, yeah, I would almost say, like, you've already been treating a while. I think if I remember right, you're already using marjoram. If it is the adductor, let's have you do some anti-inflammatory stuff on it. If you have any chamomile, yarrow, blue tansy, even eucalyptus citrodora or ironbark eucalyptus, that could be something anti-inflammatory enough to help reduce. The thing that's nice about the German chamomile is the German chamomile, if there's fluid, it will disperse it. But usually in a groin pull, there's not a lot of excess fluid. That happens more like around the knee or a hip, especially a knee. And so you just probably need to reduce the inflammation, let it heal. And so the pain also, the galbanum internally usually will help reduce pain. But I'd like to see probably a lot of topical treatment on this. It sounds like you're pretty athletic, and so probably treating topically is best. And so anything anti-inflammatory should be helpful. The peppermint's good for blocking the pain, but it won't really reduce inflammation too much. And so you can augment the peppermint with some things that are anti-inflammatory.
Okay, and I believe I have chamomile in possible. I know I have eucalyptus. I don't know if it's the one that you specifically mentioned, but I do have some topicals that I can apply to it.
Okay.
For
The
inflammation.
eucalyptuses that are really anti-inflammatory, they smell a little bit lemony, like they smell like lemon. So just regular eucalyptus, it could be okay. But if you have chamomile, slap some chamomile on that. Yeah.
Okay, great. Thank you.
Yeah, you're so welcome. Helichrysum would be another one. If you have helichrysum, slap some helichrysum.
Do you have any suggestions for persistent heat rash?
Well, you could do a couple of things. Rashes, eczema, Kunzea works really well, but for a heat rash, I mean, just the good old fashioned lavender might actually knock that out. Let me see if I have something in my notes. Yeah, you could use lavender, but actually in my notes, I have yarrow. Yarrow, and sometimes, as weird as it sounds, some of the spruces. You know, you put it in lotion and rub it on the area. But, yarrow is probably your best bet.
And all of them in a lotion? Or
No, I
yarrow?
just choose one. Yeah, yeah. Oh, all of them go in a lotion, but you don't need to mix them. Just like choose one and
Her sister had a good thought too. She thought you might want to let her know, stay out of the heat,
yeah,
Zakia.
yeah, yeah.
Love having you on, Zakia. Crack me up. Would the Vital Center oils be good for someone who has lung cancer and has been on chemo for 6 months?
Any sort of cancers, the vital centers are really can be helpful. It's even when I was doing healings all the time, you know, I would do a version of it. You know, it would take a long time, but I would do a version of that to try to calm down the growth of the cancer and then the agitation from the chemo and things like that. And so the patients usually did substantially better, you know, even if they had the surgery. They got through the chemo doing much better. You know, they didn't have the dips as quite as bad with the appetite, and they had very little depression going through all the things that they were going through. And so, you know, that is an issue. There's depression for what they're going through. They lose their appetite, and then there's the simple growth of the tumor. And so the Vital Centers really helps to address all of
Oh, Kia says, thank you, Craig. It's not her sister.
that.
I've been having unusual fatigue all day for the past week or two. I can't tie it to any issues with nutrition, movement, medication, emotional stress in particular. I drink 2 cups of coffee a day with a couple of drops of cinnamon leaf in it. What could be making me so tired?
It's hard to say. It's actually been a very common complaint over the last few weeks. And so I think there's a group fatigue. You know, sometimes we go through a bunch of things in society that then when things start to regulate, we all kind of go, and, you know, it can be fatiguing. And so you can try increasing the cinnamon. I mean, I wouldn't increase it too much, but the other thing that I try to start doing with this is, you know, allow yourself to get a little bit more rest. And I do things to instead of kind of stimulating things, I like to fortify. And when you think of like fortifying like the nervous system or your body, your brain, you could always go to things that are resinous or evergreen. So like spruces, firs, frankincense, myrrh, all of these are real supportive to the body and fortify it, you know, in a way that the body gets stronger over a period of time. Melissa is also one that can be helpful, but that way I would say take internal, and it's also expensive. And so usually go to the evergreens and like the myrrhs and like opopanox and alemi, you know, something like that. Anything you have in your kit that is along those lines. My kind of go-to one is spruce sitka, you know, the sitka. But if you have black spruce, if you have hemlock spruce, some myrrh, some frankincense, you know, several drops on your wrist several times a day. You know. And keep taking the cinnamon, but also allow for a little bit more rest.
My husband has chronic bronchitis and sensitive lungs. We are renovating the last room. He's doing the work. It's very dusty. His chest is congested now. Feels like the bronchitis is spasming. The bronchitis are spasming. Anything that will help calm the bronchioles and clear the lungs. He's struggling with breathing now a lot. Grumpy too.
Yeah. So, so I have an odd question. Like if you stand close to him and you know just he breathes a few times, is there an odd smell, like a kind of a rancid smell or a foul smell that kind of comes out of his nose?
Yes.
Yeah. So that right there, your number one thing that you can use is in the Maluka family called Neoli, not Neroli, Neoli. You know, it smells like a eucalyptus-y kind of thing. It works really good for things like this. He can inhale it. He can take a few drops internally, but I mean, a lot of it needs to be rubbed on the upper chest. And so in this particular case, nothing really works as well as Neoli. It's not expensive. Yeah, it's. I mean, that's his new best friend. I mean, he's just take a bath in it, rub it on his chest, have him inhale it, a couple drops of water. You know,
Gets rashes. He's sensitive to.
put it in lotion if he's real sensitive to that. And you can also, instead of rubbing on his chest, if his neck is less sensitive, then rub it on his neck. That works.
That it? That's easy.
Yeah, I mean, you can always add like things like thyme or something like that. But honestly, most times with that, I've been able to knock it out. Excuse me, with big dosages of Neoli. It just knocks it out.
And if he did it internal, did you say internal?
Like a couple drops in water, you know. I mean, he can just keep it in his pocket and just pull it out and smell it. Long, slow, deep breaths, you know, 5, 6, 7, 8 times a day.
I've had a couple people ask about a couple of the different soaps. One of them just asked, will the soap that Greg mentioned last week be available online soon? I think it was a detox soap. I'm guessing it's the birch tar. Maybe, I don't know which one it was. We don't have a specific, I don't know about, yeah, I'm just like.
The reason why I'm going, you know, we just kind of made it as an experiment. We've been putting it in orders. I don't know that we ever thought about selling it. We were just kind of making it for gifts for the students. But yeah. Do we have enough made to where we could put it on the site? Or?
We could see.
Yeah, well, let us check to see what we have. And I think the last two things that we made were birch tar and parsley. Is that what we did?
Yeah, we did parsley soap. Yeah. We did the birch tar soap. We have the coffee soap.
Coffee soap, yeah.
Found a chocolate root cleanser soap.
Yeah, we'll start sticking some of those up on the site.
Yeah, somebody else had been asking. Oh, apparently the detox one was the parsley.
Parsley, yeah. Yeah, the parsley and the birch tar are our most recent ones, and they're both really nice. The person who makes the soap, her partner was like, this birch tar is like my favorite soap of all time. I think they love that soap. So.
Yeah, we actually have someone who specifically, she has a soap business.
Yeah. I don't have the time to make this up. I did used to a long time ago, but I don't have the time.
Greg supplies the oils.
Yeah, so we spec it out and she makes it for us.
What is the birch tar soap for?
It's a good lymphatic cleanser, good for achy joints, good for like pain a little bit, but it also is very good for the skin. They actually even traditionally use birch tar in shampoos for stimulating hair growth. So anytime it's something like that, it's usually very good for the skin.
And the coffee soap?
Lymphatic stimulant, also an etheric cleanser. It helps expel energy out of the body.
Great questions, guys. I think hopefully I got all of your questions. If I didn't, retype them in for me in the chat. But other than that, I
Yeah,
think-
those are super good questions. Keep us posted on some of those more severe cases and everything. And let's do some work on the spine. So if you can, if you have basil or galbanum, that would be good. If not, we'll come up with some others, but basil or galbanum are your first choices. And any basil will work. Okay, so begin, first off, move your back around, move your spine around, bend and move a little bit. Now, begin inhaling. Your awareness is on your front solar plexus. Taking long, slow, deep breaths, your awareness is below the ribs on your upper abdomen. Move your awareness to the back solar plexus. That's your mid-back area. Keep inhaling. Your awareness is on the back solar plexus. Move your awareness to the back heart. the area between the shoulder blades. Go to the hips, the sides of your hips. The bones in your neck, the cervical spine. The upper spine, the area between your shoulder blades. The thoracic spine, which is your mid-back area, the bones of your mid-back. And the lumbar spine. Just be still, be aware. Just let go. Keep your eyes closed and let go. We're going to do the same oil, the same application. Begin inhaling. Your awareness is on your front solar plexus below your ribs. Move your awareness to the back solar plexus, which is your mid-back area. Go to your back heart area between your shoulder blades. Your hips, the sides of your hips. The bones in your neck, the cervical spine. The upper spine, the area between your shoulder blades. The mid spine, the middle of your back. in your lumbar spine, the low back area. Awareness is on your lumbar spine. Just let go. Notice how you feel. We're going to go to the second application. So some type of fur, hyssop, or Palo Santo.
Just let us know if you don't have any of those. And are any of those better than?
No, they're all pretty.
For absolute, that'd be good.
Mhm.
Large.
Yeah, if you're what?
Large.
Begin healing. Your awareness is on the front solar plexus. Long, slow, deep breaths in the area below your ribs on your upper abdomen. Go to your back solar plexus, your mid back area. Your back heart. Move your awareness to the back heart. the hips. Sides of your hips. Cervical spine, the bones in your neck. Your upper spine, the area between your shoulder blades. Your thoracic spine, your mid-back area. In your low back, your low spine. Just be still, be aware, just let go. Begin inhaling. Your awareness is on the front solar plexus, below your ribs. Move to your back solar plexus, your mid-back area. Go to your back heart, between your shoulder blades. Your hips, your cervical spine, the bones in your neck. Your upper spine, the area between your shoulder blades. It's very
Yeah, things to do.
your mid back, the bones in the middle of your back. And then your lumbar spine, the low back area. Just be still, be aware, and let go. Let's try to squeeze in a little bit more. If you have mugwort, artemisia, helichrysum, or poplar balsam, Sam says she's having a hard time typing with what we're doing. Okay, begin inhaling. Your awareness is on the front solar. Move your awareness to the back solar. Back heart, the area between the shoulder blades. your hips, the sides of your hips. The cervical spine. Bones in your neck. Your upper spine, between your shoulder blades. The thoracic spine, the middle of your back. On your mid back, the bones in your mid back. Move to the low back, the bones of your low back. Just be still, be aware, let go. So you move around, move your back, your joints. This wasn't the full treatment, but it was a big part of it. What do you notice? Go ahead and share a little feedback. We have time for just maybe a person or two, but what did you notice? What was your feedback? Or if you have a question.
What is it doing for the spine?
You're actually releasing psychological energies deep within the spine. And so the last place that emotional energies come out is usually the spinal cord. And think of the spinal cord as an extension of the brain.
Looser, less cracking.
Yeah.
My neck is crunchy. Felt things releasing down my left leg.
Yeah. You should know the physical component, and you should notice, like, emotionally, mentally, you feel calmer, feel better, you feel lighter, you feel sleepy. A lot of times you feel sleepy after this.
I was distracted. I breathed. I feel calmer.
Yeah.
I feel like I need a nap.
Yeah, nap time. It's a great one to do at the end of the day. And if you want to look this up, it's actually in the teacher training class number 2. It's under spine. If you don't have a copy of it, we can get you a copy of it.
Yeah, just email us at plannedcalendar@gmail.com.
It's one of the free classes we did at the end of last year. One of the things I like to do is go back and revisit some of those things, because we go through so many things, we forget about some of the things that were in some of the classes. So,
Someone had a question.
Yeah, fire away.
Non-related.
yeah.
I believe I broke a rib at work a couple weeks back.
Painful.
I've been going between different oils topically as well as inhaling. Would you have any suggestions for quicker recovery, or at least so I can quit making these funny sounds every other
Yeah.
breath?
Yeah. The issue is like when you take really long, slow, deep breaths, it also kind of aggravates it a little bit. I've had a broken rib. It is a miserable, miserable thing. Galvanum internally. The thing that happens sometimes with broken rib, you have these little muscles in between the ribs, and it can be what you call intercostal neuralgia. And intercostal neuralgia can linger for a little bit. And so treat intercostal neuralgia as nerve pain. So you can put, the neuropathic pain relief, pain relief neuropathic. Anything with mint should help it a little bit, like camphor somewhat, but the corn mint, peppermint, and some lotion, that should be quite helpful. The galbanum should help take the pain out. Try not to take super big deep breaths, because you're just irritating it a little bit. You kind of want to, and it's not that you don't want to breathe, it's just the really big breaths can be really uncomfortable. And so try the mints. If that doesn't work, let me know. We can come up with some other things, but that would be the very first thing I would go to. Yeah.
And then a share again on this last one. I twisted my back earlier, but my back does feel looser and not as painful. I do suffer from degenerative disc disease, but
Yeah.
this was helpful.
Good. If you twisted your back, again, marjoram, basil, petitgrain, spikenard, vetiver, valerian, any of those can be helpful. And actually even like helichrysum can be helpful too. So
Inhale.
like if you can put it topically on the area or have somebody put it on, that would be better. But if not, do the inhalation.
And that's time.
Yeah. You guys, love you guys. I got to jump into the next meeting and everything. And so just a reminder, we're not on for tomorrow night. I'll be traveling, going down to Birmingham. And next week, we'll be back on Tuesday and Wednesday. So, yeah. So love you guys. Take care, and I'll talk to you soon.